Dental implants as we know them today were invented in 1952 by a Swedish orthopedic surgeon. Today they are considered the standard of care for the replacement of missing teeth. A dental implant is a surgical fixture that is placed into the jawbone and allowed to fuse with the bone over a span of a few months. The dental implant acts as a replacement for the root of a missing tooth. Having a dental implant fused to the jawbone is the closest thing to mimicking a natural tooth today. It stands on its own without affecting the nearby teeth, unlike traditional dental bridges. Most dental implants are made of titanium, which integrates with the bone without being recognized as a foreign object in our body. Today, the success rate for dental implants is close to 98% over a period of 10 years, but they're known to last several years more. The ideal candidate for a dental implant is a patient in good general and oral health. Adequate bone in your jaw is needed in order to support the implant. The best candidates have healthy gum tissues that are free of periodontal disease. If I notice you have a history of gum disease, I may recommend that treating the periodontal problem prior to moving forward with dental implants so that we can reduce the risks involved with surgery. Dental implants are intimately connected to the gum tissues and underlying bone in the mouth. They can look and feel just like a natural tooth. First, I consult with you in order to determine where and how your implant should be placed. Deciding on your specific condition type and the type of implant chosen, we will create a custom-tailored treatment plan just for you. When missing a single tooth, one implant with a crown can replace it. If missing several teeth, an implant-supported bridge can replace it. If missing all of your teeth, a bridge or denture can be screwed, cemented, or snapped onto dental implants. A big key to implant success is the quantity and quality of the bone where the implant is about to be placed. The upper back jaw has traditionally been one of the most difficult areas to successfully place dental implants due to the insufficient bone quantity, quality, and the close proximity to your maxillary sinus. Be sure to inform me if you have any history of sinus problems or infections. We can elevate the sinus floor by raising it and developing bone for the placement of the implant. Also, deformities in the upper or lower jaw can leave you with inadequate bone in which to place the implant. In order to correct this problem, the gum can be lifted away from the ridge to expose these bony defects. We can then fill the defect with bone or bone substitute in order to build the ridge back up. Ridge modification has been shown to greatly improve the appearance and increase your chances for successful implants that last for years to come. Dental implant surgery is usually performed under local anesthetic and therefore no discomfort should be felt during the procedure. After the anesthetic has worn off, post-surgery discomfort will vary with each individual case. However, in general, most people feel discomfort similar to that of a tooth removal. The discomfort typically can be managed with over-the-counter pain medications such as ibuprofen or acetaminophen. For more invasive surgeries, we usually prescribe a stronger pain medication. We also recommend ice packs afterwards in order to keep the swelling down so that you can return even faster to your normal daily routine. I will visually examine the site in the mouth where we're considering a dental implant, as well as looking at any dental imaging software such as X-rays or CT scans. At this time, the quality and quantity of the bone is assessed in order to determine if more bone is needed at the site. Once we've established that a dental implant can be placed in the desired location, you will return for the surgical procedures for the dental implant itself. During all surgical appointments, you will be numbed up as well as given any other sedative necessary for your comfort and to alleviate any anxiety. The first stage of surgery often involves a tooth or teeth being extracted. Oftentimes, the site of the dental implant still has an existing damaged tooth present. In order to prepare for the placement of the implant, that tooth will need to be removed. More often than not, an alveolar bone graft is placed to achieve a solid base of bone for that specific implant. The site will be allowed to heal for a period of months. For an existing site that has no tooth but inadequate jawbone available, it will require a different type of bone graft that is placed on top of existing jawbone. This procedure is a little more involved and usually requires a longer period of healing time. In some instances, when enough bone is present, the damaged tooth can actually be extracted, followed by the implant placement at the same appointment. This particular procedure is called immediate implant placement. However, if infection is present or the strength of the bone is called into question, we choose not to place the implant that day in order to avoid greater risk of failure, which can leave you with even less bone that you started with. Once adequate strong bone is present, the site is ready for the dental implant. At the implant placement appointment, the implant is placed into the bone with special tools. Then we place a healing cap over the implant, suture the gums, and the healing phase begins. During the healing phase, I can make for you a temporary denture or crown in order to replace the missing teeth so that it's less noticeable visibly. Healing time depends greatly on the quality of bone present and most often takes a few months. During this time, we're waiting for the bone and the implant to fuse to one another. Care must be taken to avoid placing any undue forces or stress on the implant as it heals. We will have follow-up appointments to check the surgical site and to ensure that no infection exists and healing is taking place. After the required healing period, a prosthetic component is connected to the implant via a very tiny screw. This component is called an abutment. It serves to hold the replacement tooth or crown. I will take an impression of the abutment in the mouth in order to have a custom crown fabricated by a certified dental lab technician with a shape and color to match that of the rest of your teeth. This final appearance will look just natural, as though you never had a tooth missing. The cost of a single dental implant depends on the various factors that go into this entire process. Cost includes the surgery for the removal of the tooth, any necessary bone augmentation, placement of the implants, all the parts and components, and then the final implant crown. Although most dental insurance companies do not pay for dental implant placement, each dental insurance plan is different and unique. We're more than happy to investigate your individual plan's benefits. Unfortunately, some insurance companies still consider dental implants an elective procedure, even though they have become the standard of care for the replacement of missing teeth. Dental implants have become a favorite option for tooth replacement because they offer a conservative approach and provide predictable results. With any surgery, there are always risks and potential complications to the patient or to the success of a dental implant. Careful planning is very important to ensure that you are healthy enough to undergo oral surgery and will heal properly. Just like any surgical procedure, bleeding disorders, infections, allergies, existing medical conditions, and medications need careful review prior to proceeding with your treatment. That's why it's so important for you to complete our office forms with both honesty and accuracy. Fortunately, the success rate for dental implants is quite high, but failures can occur in the unlikely event of infection, fracture of the implant, overloading of the implant, damage to the surrounding area nerves, blood vessels, or teeth, poor positioning, or poor bone quality and quantity. Again, careful planning can help avoid these issues. In many cases, another attempt can be made to replace a failed dental implant after the requisite time for healing has taken place. Dental implants also have the risk of developing a condition called peri-implantitis. This refers to the inflammation of the gum and the bone that surrounds the implant. The inflammation of surrounding tissues is often due to excessive biting forces on the implant or bacterial infection that may exist around cement. Peri-implantitis can result in the loss of an implant if left untreated. After receiving a dental implant at Sixth Sense Dental, routine maintenance care at home, as well as follow-ups at our office, are essential to avoiding this condition. Your typical home care involves routine brushing and flossing to keep food debris and plaque away from sitting around the dental implant. At your cleanings, the surrounding soft and hard tissues are examined. We often use special tools to remove harder calcified deposits that may form around the dental implant. If necessary, the bite also may be adjusted to ensure that the implant does not sustain overwarranted biting forces.